Hey everyone, it's Dr. Luke.
Dr. David.
We are in our new Curiosity Corner spot here, enjoying some beverages, the RX swag. But we are here today to bring back our Curiosity Corner segment where we're going to be talking about lumbar strains or low back injuries in the gym. Specifically, kind of the injury occurs when you're lifting something heavy, let's say deadlifts, or you're doing a clean, or even just picking up weight from the ground, and you feel like an acute pain in your low back. The really kind of everyday term for that, is people say I pulled my back or
Threw my back out.
threw my back out. Those are kind of the common things that we hear. A diagnosis getting thrown around would be like lumbar strain, all right? And the difference between a strain and a sprain, a strain involves the muscle, the contractile tissue, where the sprain is more joint, and we can kind of dive into that a little bit. But the purpose of the video today is for Dr. Dave and I to really help you navigate that situation if it does occur, and when to identify if it's something that you need some immediate care for, or if it's something that kind of follows that typical low intensity kind of low back trauma, and kind of the timeline of recovery and how you should get back into the gym. So
Let's just start with worst case scenario. Let's say you were in class at 4:30, you threw out your back, you're going to sleep tonight, and you have tremendous pain. What's an emergent, when do you know that you should go to the emergency room, or when you should see a doctor, or when you should keep lifting?
Yeah, our initial impulse as humans is to go to the ER, get to the urgent care center and get some medication. When that's not always the case, I think the red flags, as we call them, would be something where you're losing bowel or bladder function, where you're accidentally peeing yourself, you're feeling like significant loss of strength in your leg.
Can't move your leg.
Can't move your leg, right? These are more signs of what we call spinal cord injury, all right, or neuralgia, and those are more serious conditions that we need to get assessed right away. So if that occurs at any point after an injury like this, that is more of an urgent situation. I would recommend getting you into some imaging and get some care right away. Any other red flag type situations? I think those are the main things to think about. Outside of those, most of these situations can be managed rather conservatively. Acutely, if you do need pain relief, obviously, you can start with kind of the ice. If it's very acute, rest, laying down, trying to find a position of comfort that actually kind of decreases that pain. And then if you need medication, right, you can obviously go to the cupboard and get some NSAIDs. Most of the research is not really supporting use of muscle relaxants and any other kind of pain relief that's going to involve a nervous system, a nerve, decreased nerve pain. Those things aren't really working as well as they thought they would. What do you typically recommend after that acute trauma?
Like you said, positional, what you can tolerate. Figure out if it's sitting up, if it's sitting down, just work on that. Eliminate the things that are semi-provocative for you. If it really hurts, just get down to the floor. In that first 24, 48 hours, you're okay to modify. Do things that promote your motion, promote your mobility. The number one thing we educate our patients on is minimizing the fear and the threat that you're gonna hurt your back further. A lot of times, like Luke kind of set up that's a mechanical strain. When you have that injury, that's not that urgent care, emergent nerve issue. Most of our patients fall into that. It's a muscle issue, and it just feels so tight, when you bend forward or even when you move back. And so our first line of defense is always decreasing the threat, figuring out what positions you can tolerate. There's gonna be positions you can tolerate, whether your pain's at a 7, but if you move, you're at an 8, well, the 7's where you can tolerate right now. And you wanna start to just get used to slow and steady movement. If it hurts to bend forward, can you bring your legs up to stretch your back? Okay, if it hurts to extend back and reach high, can you lay on your stomach? That first 24 hours is figuring out how your body can adapt to life. And then beyond there, it's figuring out what's the type of motion that feels better. Is it a stretch? Is it a hot pack? Is it a shower? Is it a movement? Is it breathing? Whatever things that you can control, that's the most important thing to decrease that kind of fear that you're going to hurt your back. And then it's, what can we do after that 24, 48-hour window? What exercises do we like to promote for our patients? Like, what things do you like to do?
Yeah, I mean, pain-free movement, right? Movement is medicine, and the ability to, if you can get up and start walking, right? It's initially going to be just pretty uncomfortable. There's going to be discomfort. As you move a little more, the blood flow starts to go. You start to nourish and give nutrients to the nervous system, and that kind of decreases that sympathetic response, and you're allowed to move a little more. Obviously, you need to be smart with when you get back into more high intensity exercise. There's got to be a graded progression, right? Can you walk pain-free? Okay, let's see what you can do with some biking and some body weight stuff. Is that pain-free? Okay, great. How's your response after 24, 48 hours, with those activities? No real increase in pain? Great. Let's start to progress even more. And, really, there's timelines to recovery, but, let your tissue, let your nervous system be the guide of what you can get back to doing. And, we always say if you need someone to help guide you through that process, and that's what, rehab professionals like physical therapists and chiropractors, that's what we're here for. That's what we do, is help educate you on how to gradually get back. But also, like Dr. David said, is how do we decrease your fear that you've done something really serious to your back and you're never going to walk again? Like, that's where our initial human nature goes to, and we want to, decrease that fear and increase your confidence to get back moving safely and effectively. So, that's what this video is all about, is to really help you kind of understand the injury, not be afraid of moving. Movement is medicine. Use some of these tools and modalities like ice and NSAIDs if you need them to help decrease some of that inflammation, but confidently starting to get back to doing the things that you need to do on a daily basis, and then progressing back into exercise after that.
Yeah.
So if you need more help with that, that's what we're here for. Obviously, you can subscribe to our channel, and if you need more information, don't hesitate to reach out, and we're happy to help.